I want to congratulate Jim Barry on his recognition. Jim has been an amazing leader, not only for our university and our health system, but truly for our entire state.
I couldn't possibly capture all that I have learned from Jim in just one short video, but here's a few of the highlights. I've learned how to treat patients with the absolute utmost respect and compassion. I've learned how to grow a pretty standard psychiatrist beard and mustache. I've learned how to treat my colleagues like family, and I've learned how to not let a lot of gray hairs stand in the way of me believing in myself.
The challenges for those with mental health conditions has been magnified during the pandemic, and during this time, Dr. Barry and his team have risen to the occasion and met this challenge by rapidly converting in-person visits to telemedicine visits so that people would have access to mental health and addiction professionals during the pandemic. Dr. Barry has also been an important leader for our research team with innovative first-in-the-world clinical trials using focused ultrasound and deep brain stimulation to combat opioid use disorder.
I'm Dr. Mark Gold, and as a previous winner of the Addiction Policy Forum Pillar of Excellence Award, let me tell you how excited I was to hear about Dr. James Barry winning this award. In addition to being a stellar clinician, a great teacher, role model, and mentor, Jim also has been pioneering new approaches to treatment, from the use of transcranial magnetic stimulation in addiction recovery to even deep brain stimulation in cases that are refractory to all treatments.
Jim is an incredible caring leader who is exceptionally skilled at delivering outstanding patient care, shepherding many people with addictions through their life journey to one of sobriety and one of success. We believe deeply that each person in our state who suffers from any kind of behavioral health problem, including addiction, deserves to be treated like we would have somebody in our own family. And Jim Barry does that.
His patients really deserve a seat at this accolades table too, so I reached out to a few of them to get some feedback, and this is what they had to say. One patient remarked, "He is absolutely the best doctor I have ever worked with," while another stated, "Oh, he is never wrong." And of course, a few patients commented on that beard, good Lord, that beard. One patient in particular had this to say about him, and I know her sentiments are echoed by many. "I feel like I could trust him from the moment I met him, and I knew in my heart he didn't judge me for being an addict. Instead, he showed me respect and compassion. Dr. Barry isn't just a doctor, he's an advocate for those of us who have few in our corner. I know that at my appointment with him, I'm not just another patient like a number, but that he actually sees me. He saved my life."
Raleigh and I worked together to say a few words in honor of you in this special occasion, and to make it a little easier, I'm going to speak on his behalf. Congratulations, Jim. We heard the Addiction Policy Forum was looking to award those who shine in the world of addiction medicine and policy advocacy. And, well, Raleigh couldn't think of anyone more deserving or who shines more on behalf of the patients and families struggling with the disease of addiction. When I talked to Raleigh about the words that come to his mind when he thinks about you as a resident mentee, a colleague, and now the one who has taken the torch Raleigh kept lit for so long, these were the words that came to him. You said, class,
very smart.
Class and smart. You think Jim Barry is classy, and you think he's smart.
Very good.
Very good. Now, speaking for Raleigh, I'll tell you what I know he would say to you in honor of this accomplishment, if his words came to him as easy as they did before. You would have said to Jim, "Jim, I couldn't have asked for a better resident to mentor into the roles you now fill. Your success is largely due to your servant's heart. Not only do you have the skill to lead these efforts to which you are so formidable, but you have the heart to lead. But yet there are 3 important cornerstones that I taught you that I know continue to drive your work today. And with these in mind, you'll continue in your success in saving the lives of so many. You were a sponge, and you believed me when I told you, 1, addiction medicine is medicine's best kept secret. You are treating and advocating for a population that many other physicians prefer to avoid. 2, with the right treatment and support, patients can and do get better and recover from addiction. Many others prefer to avoid this population and their families because they see their disease as a moral defect versus the chronic disease that it is, or they find little hope in the reality that people can and do get better. You believed in my hope, Jim, and it continues to drive your work today. 3, the patient is never the problem, right?
Yeah.
You always said, people often had a hard time believing me when I said, the patient is never the problem. You believed it. You know that patients can and do get better, and when there is a barrier, it is not a barrier created by the client, but barriers such as a paucity of trained practitioners, substandard care and concern for these patients trying to survive this disease, and at times a lack of weakened policies to support the providers in providing the best level of and safest care possible to improve outcomes. Among a few others, Jim, these were the central truths that drove my practice, my teaching, and decisions over the years, and it never steered me wrong. And I can see these central truths also drive your practice, your teaching, and your decisions today, and these will never steer you wrong either. Hang on to these truths, Jim. Keep your servant's heart, and keep up the hard and important work you are doing. Congratulations.
We're very fortunate to have Dr. Berry at the Rockefeller Neuroscience Institute in our state. He's a compassionate physician, an educator, and an innovator who tirelessly works to improve the lives of those with mental health disorders. Congratulations, Dr. Berry, on this well-deserved recognition.
Jim, your WVU Medicine family is incredibly grateful to you for all that you do, and congratulations on this well-deserved award.
I can't think of a better person to win this award. Jim is just the kind of guy that other people in addiction medicine want to emulate. They emulate him because of the data, they emulate him because of his caring and compassion, and they emulate him because he's been just a leader in our field for so long. So thank you, Jim Berry, and congratulations.
As a leader taking care of his own people like family, as a physician who takes care of our state's residents like family, and as a state leader who is making the world better for all West Virginians, Jim, we owe you a debt of gratitude and a hearty congratulations.
I'm so proud of you. Very good. Proud of you.
Congratulations, Jim. Take care.